Hello, I am Radhakrishnan coming from far off just to meet you, sir. How are you? Can I sit here? Thank you. So, your mother called me yesterday saying that you wanted somebody to come and meet you. So, I came from Kochi just to meet you. So, what's your issue? Any help I can give you?
I don't feel like talking.
Then you take rest. I'll come another time. Will it be okay for you?
No,
I'll wait outside.
you can continue.
Okay.
So maybe take your own time when it is about communicating with the patient. The patient may not react immediately. So that is an important aspect. Next, we'll demonstrate the active listening skills. Without active listening skills, it would be a bad communication, because then you are trying to influence the patient with your own thoughts rather than understanding the mindset of the patient. So we are continuing with that. You don't know, I have cancer. I have so many unfinished tasks. What will happen to my family after me? Who is going to take care of them? My kids are small. My wife is already overburdened. She has left her job. So I don't understand what to do. So you have seen that in this case, Mr. Menon has not interrupted. He is simply listening to the patients, because once you interrupt, that communication barrier comes in and the patient is not going to interact, because this he has not been talking to anyone, even to his family members, what he is talking to you. I think we have made things clear. Now, Mr. Menon, the patient, you can understand, is in deep distress. How you are going to tackle the depression of the patient? Because he is not only having the physical pain, you can see he has mental pain, he has emotional pain, his wife has lost the job, and there are many unfinished assignments. So how you are going to handle this?
The patient has already given you a list of items on which we have to find answers. It may not, however, be possible for us at that particular juncture to give answers to all the questions. At least we can reduce the tension or the depression that the patient is facing at that point of time. So we'll wait for some more time whether any other items of things that he wanted to share with us, because he is in a mood to share with us what all agonies he are facing. Suppose if we interrupt in between, he may not be able to continue the discussion with us. So we will see what all they are in store for him to share with us. So we will say, we will ask whether any other issues are there to be unsettled, or you want to address and all that. And we will wait for 1 or 2 minutes for the patient to continue. There may be some more rather more important and more crucial issues that the patient may be facing at that point of time. So we will have to understand the what you call the agenda, the total items that he has to face, and we have to what you call categorize the importance related to the needs that he wants to satisfy. That is a second option. So I will wait for another 1 or 2 minutes for him to continue the discussion, and if say nothing is forthcoming, I may request whether any other items are need to be explained to me, then I will slowly and slowly answer one by one. So that is the next phase.
So you know that I could not pay the fees of the children, and the school has told them not to come to the school. Since my wife was taking too many leaves, her employer asked her to go away. And again, you can see all these expenses are being handled without any income. I am just puzzled.
So that is the you see additional information, or again he is giving the same thing. So we understand that these are the important things that he has at present, and we will slowly ask, is anybody here to to support you? Are there any relatives or close friends who will be here to help you out in this juncture, or you need any outsider to come into the picture so that some sort of help, or no, I can speak to the employer and apprise him of the situation of the present condition of the patient, and I will apprise him. I will be via media or an or whatever, via media or a link between the patient's wife and the employer, so that some harmony can be evolved. And we will start slowly. We cannot keep all things in one basket. It may not be possible for us. So one by one we will find out the real situations and try to address each one by one, not all. It may not be possible, as I said earlier, may not be possible for us to address all the issues, but when we take it in individual cases, case to case basis, naturally some sort of answers will be evolved. Moreover, rather than addressing those issues, they want somebody to listen to their grievance. That is the most important thing that a patient or the caregiver wanted us to have. To we can just sit there and permit them to say whatever they want to share with us. That is the most important part of this situation.
So you know that since I have cancer, I did not tell anyone about this other than my wife. My neighbors don't know it. My relatives are not aware, because I don't know how they are going to react if they know about this.
So he is worried about not telling the truth to anybody else other than the wife of the patient. The wife of the patient alone is knowing the truth. So we don't find any peculiar situation. This is all general. So when a particular type of disease is afflicted, at that point of view we do not generally, even when we have a small headache, we used to avoid people telling, I have a headache, I have a headache. So take for example this type of cancer, when it is afflicted, naturally we may have some stigma, as we call it. So stigma is an important thing that gets into the way of actual communication. And now the patient says that we have not shared this information with anybody else other than the wife, in the fear that suppose if somebody gets to know that I have cancer, there is a likelihood of building up an opinion among the neighbors that cancer is somewhat contagious. So there is a social stigma. Actually it is not contagious. So we should encourage people to understand that cancer is not contagious, and suppose if it happens to me, it can happen to anybody else at any point of time. So it is not contagious as such. So knowing the truth by the neighbors is not a bad thing. So we can motivate or encourage the patient and the family members or his wife that you can share the information,
Because
to
then only
then
they
only
are going to
they
give
are
their
going to
cooperation.
give you a cooperation. That's it. Some good-hearted people, we have all are having hearts. They are all good, we have good hearts. So, when we say the truth to a patient, then only the patient will react or respond to that in a positive manner. So, suppose if the neighbor understands that this fellow is cancer, he can just give you some tips regarding the centers where further treatment options are available, or anything else can be done. Moreover, this is ruining the whole financial condition of the family, and naturally some of the close relatives will come forward and say, I will give you so much of financial support, you go to that particular hospital, do the rest of the treatment, and suppose if you are having any financial problem, we are there to help you out. Only when you disclose that to another fellow, then only he will be able to know the truth, and they will come forward and help you in that regard.
Thank you. So probably most of the problem of these patients are because of the fact that he has not shared his news to others. The school could cooperate, continue to educate the children, knowing that this man is a cancer sufferer and he has no earning at all. Probably the employers of the wife are not aware that her husband is suffering from cancer, and which requires regular leaves to be taken for his treatment. Neighbors don't know, they could have helped in any way, but as they don't know, they are unable to support. Relatives again, they are not aware about the situation, and that is the reason probably this problem of the patient is increasing manifold. So as a counselor, as a support team, as a palliative care professional, we would try to meet the school principal,
Definitely.
convince about the scholarships and continuing the education of the child. We'll meet the employer, tell them about the facts and problems of cancer patients, because many a times people are not aware about the problems being faced by the patients.
That's right.
So probably we can restore the job of the lady, but again the question comes, when this lady is going for the employment, who is going to take care of the patient? That is where we can involve the community and neighbors, and they can probably volunteer to assist the patient and the family.
That's right.
So that is very important. We can help them out. If there is will, there is a way. Thank you.